Greetings to everyone. This is Doc Cherry, Doctor of Physical Therapy. Have you ever felt dizzy? Dizziness is actually one of the most common symptoms experienced by both men and women worldwide. This is usually common to older adults and even our elderly loved ones. There are many reasons why you may feel dizzy. Low blood sugar, especially if you're diabetic, low or high blood pressure. It could also be an effect to the current medications that you are taking, a problem in the inner ear, or in minority of cases, a problem in the brain that controls your balance. In this video, I will teach you practical tips and one exercise that will treat the most common cause of vertigo, which is known as benign paroxysmal positional vertigo. But don't be intimidated. BPPV or benign paroxysmal positional vertigo is only a medical term that refers to dizziness that is aggravated only when you move your head. If you're new here to my channel, please click the subscribe and the bell button so you will be updated with my weekly videos. Also, please feel free to type in Doc Cherry in YouTube where you can access my playlist and you can check on my free healing videos that will promote relaxation and will promote better sleep. In 2008, Janet Jackson had to postpone 9 shows because of dizziness and imbalance. NBA superstar LeBron James also explained himself that the reason he falls down so much is because he suffers from dizziness. It was also during these times of frequent falling when James was being criticized by the media and fellow NBA players themselves.
And today we're going to take a look back at some of his most hilarious...
James said that he wished people understood the illness that he had. Other famous men who always complains of frequent dizziness would include Nicolas Cage and George Clinton. It is very difficult to feel that you are moving when in reality you are just actually standing still. You will feel off balance. You will feel like you are spinning or that the world around you is spinning. These life-altering symptoms can deeply impact your ability to perform basic day-to-day tasks, and sometimes it makes it difficult for others to understand that a person with dizziness is probably struggling just to remain functional. It's never normal to be dizzy regardless of your age. The most important thing to realize is that vertigo or dizziness is not something that you have to live with. Watch until the end of this video to put an end of this disabling symptom. 80% of all vertigo is caused by benign paroxysmal positional vertigo or BPPV. BPPV is caused by a problem in your inner ear. This is caused when calcium carbonate crystals in your ear that helps you maintain your balance gets dislodged into your semicircular canals, which in majority of cases affects your posterior semicircular canal where they shouldn't be and could be caused by a head trauma or an ear infection. Your semicircular canals are sensitive to gravity, and the calcium carbonate crystals triggers sensors in your semicircular canal, which gives you a feeling of dizziness. This is the reason why you feel that you are spinning or tilting even if you are not. This is usually triggered when you move your head in certain ways, such as when you roll in bed, when you unknowingly turn your head quickly, when you bend over to pick something from the floor, or when you tip your head back. This usually takes between 60 seconds and would come and go. Could be mild or bad enough to make you vomit and make it difficult for you to maintain your balance while standing and walking. You may also find it difficult to read or see during an attack due to nystagmus. where the eye involuntarily moves vertically and rotates towards your affected ear. Although BPPV affects your inner ear, you should take note that there is no associated hearing loss as opposed from its counterpart, Meniere's disease, which also causes dizziness but presents with hearing loss on the affected ear. If you think you have BPPV, ask yourself these questions. Is your vertigo triggered with movements of your head? Does these symptoms last for 60 seconds but comes and goes? Do you experience involuntary movement of your eye, sweating, and vomiting? If you have BPPV, be extra careful that you don't hurt yourself or someone else if you have a sudden attack of vertigo. Do not drive if there is any chance that vertigo could strike and make you lose control. Don't use tools or machines that could be dangerous if you suddenly get dizzy or lose your balance. Avoid quick spins or movements that will provoke vertigo. Keep your floors and walkways free of clutter so you don't trip at home. Avoid heights.
Man possessed by the paralyzing vertigo that made him afraid of high places.
Easy now.
I know. Well, this is a cinch. Here, I look up, I look down. I look up, I look...
Sleep on your back. Tilting your head to the side or rolling into your side can trigger your vertigo, especially if you sleep in your affected side or ear. Use wedge pillows to elevate your head slightly. This will make you feel better. Move slowly as you get out of bed, allowing your inner ear to adjust to the new head position. Gradually rise up and then sit for a minute on the side of the bed before getting up to walk. Reduce stress to minimize vertigo. It will also help you sleep better. Stay hydrated with plenty of water since dehydration can also cause dizziness, and limit your caffeine and alcohol intake. Also, eat anti-inflammatory foods to ward off vertigo like leafy greens, bananas, and avocado, and healthy fats from fish. Physical therapy or vestibular rehabilitation can help with BPPV. The head is put through in a series of specific movements that aims to move the calcium carbonate crystals out from your semicircular canals, relieving you from the symptoms. Initially, the exercises may temporarily worsen symptoms, but if you continue doing this exercise, you will notice decrease or even complete relief of your symptoms where no other treatment may no longer be necessary. This exercise is called the Branderuff exercise. What's good with this exercise is you can do this safely at home on your own. One repetition would only take you 2 minutes. Here is what you will do. Sit on the edge of the bed. Turn your head to the left at approximately 45 degrees or as far as it is comfortable for you. Then you lie down on your right side. Maintain the position of your head for 30 seconds or until dizziness has subsided. After 30 seconds, you sit up and go back to the starting position with your head back to the center. This time, look at your right side at approximately 45 degrees or as far as it is comfortable for you. Then lie down on your left side and maintain this position for 30 seconds. After that, sit back again and you have just completed 1 repetition. Repeat it 5 times. You need to do this 5 repetitions at least 2 times a day for 2 weeks. Or if you have time to do this, you can do it 3 times a day. And this would add up to 52 sets in total. In most people, there is complete relief of symptoms after 30 sets or about 10 days. Thank you very much for watching. I hope that you would be mindful of the practical tips and the exercise that we have talked about, because this is a conservative management for your vertigo. But if you don't have any relief of your symptoms, please have yourself checked and evaluated by an ENT doctor or contact any licensed physical therapist near you so you will be guided more accordingly. Should you have any questions regarding BPPV, please feel free to comment down below and I will surely get back on you. Also, please click the like button if you find this video helpful. Please share it with your family and your friends. This is again Doc Cherry. Stay healthy and God bless you.